Hey, Jason Barlow, the Center for Muscle Therapy here. Today I'm going to show you a routine that I like to use to essentially self-massage before I do my workout, particularly for all lower extremities. So that's from hip flexors, hip extensors, down through the quads into my hamstrings and calf. I'll guide you through a little bit, but otherwise just watch, try, experiment, and get a sense of what works best for you. The only caveat to what I'm about to do is avoiding direct pressure into this bony protuberance right here. This is a spot that we don't want to put too much pressure onto, but everything below that point is fine, around it and in front of it. And again, just listen to your body as you're working. Okay, here we go. So getting into that hip flexor first. I'm gonna go at the end of the foam roller and just target in. Now I can judge how much weight I want to put through this with my arms and the opposite leg. So maybe I'll move back a little bit so you can see a little bit more position I'm in. This leg here is fairly redundant. I'm just rolling in. It's fairly moderate to high pressure, and I'm really feeling that through my hip flexor. I'll spend maybe 60 seconds working through this spot. I'll just rotate slightly, hit a different point, same muscle. And from here then, a little bit more side on. And again, avoiding direct pressure to that bone. Just trying to find particular spots that you can really feel more than others. Like now as I rotate more and I get into my glutes, now that's getting spicy. So I'm going to hang out here a little bit, just rolling back and forth. It's small movements you can see. And I might go a little bit further over, but again, it's still small movements that we're using. This leg here, the one that you're actually rolling through, fairly redundant. This one's kind of got the weight to it, as well as my arms. Just a rocking back and forth. Overall glutes. Getting both sides now. And from here, I'm going to come back into the anterior portion. So I'm going to go quads here now. I'll give you a front view and now I'll go side view. But rolling through, using the opposite leg, using my arms to get that leverage. Again, for us guys, just want to be conscientious of the rolling action. You'll quickly learn what's right and wrong about that. Going all the way through that chain of quad, hip flexor, right along the front of the thigh, just to give you a side view here. Rolling through from that hip flexor where we started, all the way through the quad. Now we can rotate slightly, get on the inner side of the quad, almost getting into the groin, and you can kind of dictate how much is too much. You're in complete control of this. Whereas when people come to see me, I got way more control now, or at that time, to massage their body and put pressure on. But with this one, you're in the driving seat a lot more. So again, fairly moderate to intense pressure. This is definitely more sensitive here on my groin and adductors. Note here, we have the femoral artery running through this region. So again, minute is going to be okay. Moderate pressure is okay. A little bit intense is all right, but we don't want to hang out too long in this region, putting direct pressure on that femoral artery. So just a minute in that region, come off, take a little break, and then repeat another minute in that region if you want to. Next, we'll go into the lower extremity. So we'll get into a little bit the shin. This is great for any runners. In through that shin tissue, it's back and forth. Now I've raised the opposite leg and that puts more pressure on for me. Now I've got more upper body work going. And then I'll turn sideways to get the perineal, the outside of the ankle. Anybody, especially basketball athletes that have rolled their ankles, this gets pretty built up with some scar tissue and tension. And again, we're going all the way up to the outside of the knee ligaments. That's okay to, again, put some pressure on, but that pressure is definitely more light to moderate, whereas this pressure as I get into the fleshy tissue is more moderate to more intense. Moderate to high. All right. So then we'll go into the posterior. So as I've just experienced, you can see how, this is why I'm going shirtless. T-shirts, laces, as I just found out, can quickly get wrapped up in this roller. So just keep that in mind when you're gonna go do this. But here's the calves, so I'm putting both on simultaneously here. And all we're gonna do is just roll back and forth. Just a general kind of gliding through, gets that blood flow into the tissues and just starts to agitate the area. And then what we can do, if we want to get a bit more focused on the calves, which I'll do in a moment, is we'll go single leg. You can vary your intensity more, but especially we want to get right down into the Achilles. I'd even be inclined to take the shoes off if I was spending more time on this and I needed more concentration on it. And we can turn the feet in slightly and out just to hit different angles of those soft tissues in the lower extremity. And then we'll go into the hammies. So all along the posterior chain, we've done the glutes already, so we're just gonna go right up to the attachment point, into the hips, right back down. Again, reducing the load and intensity as we get to the back of the knee. We have, again, some fairly superficial nerve and blood vessels. So we don't want to spend too much time with large amounts of pressure there. Rolling through is okay, but through and back, all through the muscular tissue of those hamstrings is what we're after here. And again, if I want to spend a bit more time on this, if I'm doing a heavy leg day or my hammies are particularly tight, I'll just bend this support leg and then play with this and get the right amount of pressure. So this roller I'm using is a 6-inch. You can get a 6-inch, a 4-inch. You can even do similar type of motions using a lacrosse ball if you're feeling brave. That just gets in more directly to particular smaller groups of the fibers. This is more of a generic method to get in on the hammies and the big muscles. Again, I'm just rotating my leg and hip slightly just to hit different spots and angles. Like this area here is definitely more sensitive than when I go this way. That feels, I can feel pressure, but when I go this way, now it just feels definitely pressure becoming almost pain. So again, I'd hang out, spend a couple of minutes in this area, and then I'd repeat that on the opposite side, right? Same idea. I can go right down to my calf, single leg, using my upper body to kind of create leverage through the calf tissue. Once I've done the calf, roll through, get into the hammies, all the way through. Again, rotate the leg, get different angles, at different spots. And there's no harm in, if you find a particularly gnarly point in that hamstring and you feel, especially if you use a lacrosse ball, you can get even more specific with this, but you can hit a trigger point, right, which radiates pain down the leg or into the hip or into the back. It's quite common. Is just hang out there, hold it for a good, I'd say minimum 30 seconds. Your body will kind of tell you when it's enough. Like if you feel that initial high pain sensitivity is reducing and eventually going, that could take 30 seconds, could take a minute to 2 minutes to dissipate. But once you find it's dissipated, then that's the time to move on, essentially. So hopefully you're seeing some good examples there of how to mobilize, warm up, agitate, self-massage all the lower extremities. I'm getting ready here for my workout now, so I'm going to leave you. If you have any questions, just post them below. Otherwise, check us out online, massageokotooks.com. Thank you.